Hello, you're welcome. My name is Dr. Chris Williams, and I'm your host on Well Again. Well Again is your online health magazine program in which we look at fail-proof protocols for regaining and retaining health. You're welcome. All right, today we're discussing something very important, and I'm excited to be discussing it with you today. We're discussing natural management of erectile dysfunction. How do you turn around erectile dysfunction? First, I would like to state that, and it's important you know this, because many people will have erectile dysfunction, they just keep struggling with it, but they don't seek help. If you seek help, you will get help. Because about 85% of cases of erectile dysfunction can be treated, they can be corrected. You see, there are two categories of causation of erectile dysfunction. There is the psychological cause, which constitutes just about 15%, and there's the physical cause, which consists of a whole gamut of other causes, and this consists of about 85%. And these physical causes can be corrected if you are well investigated. If a good history is taken, we can literally hold on to what is causing erectile dysfunction and begin to treat it. What is erectile dysfunction? It's inability to achieve or sustain an erection adequate enough for normal sexual intercourse. Inability to achieve or maintain an erection that is strong and adequate enough for normal sexual intercourse. Now, how does erection happen? If we understand how erection happens, we'll be able to understand what are the causes of erectile dysfunction. When a man is stimulated, okay, some hormones are released in the brain, and these hormones act on the nerve endings in the penis and also the blood vessels in the penis. You see, the penis is a spongy tissue. It's like a sponge, actually. You know, a sponge, if you throw a sponge, is so light, fan can blow it away. But if you throw it in water and it has drawn a lot of water, it becomes turgid and very heavy. So what happens when erection happens is that blood flows, rushes, plenty of blood rushes into the sponge of blood vessels inside the penis, and that's what causes the penis to become turgid. Okay, so that's what happens. Now, so if there's an interference either in the brain stimulation is not able to take place, or the release of hormone doesn't happen, or hormone is released but the blood vessels don't respond to the message of the hormone because they have been blocked, or the nerve endings don't respond to the message of the hormone because they have been dulled, whatever it is along this line can lead to erectile dysfunction. Several causes. Metabolic syndrome. In metabolic syndrome, the person is on the verge of breaking down, actually. His blood pressure is going up. Maybe it's around 140, 150 by now. His blood sugar is going up. Maybe it's around 115, 120, 130. It's not yet in established diabetes, but is on the boundaries of hypertension. It's on the boundaries of diabetes. His insulin is high. His cholesterol is high. Metabolic syndrome is one of the foremost causes of erectile dysfunction. Also, peripheral vascular disease. Peripheral vascular disease. It's a disease that destroys the vessels, the arteries and the capillaries that supply the periphery. It can happen anywhere in the body, especially in the fingers and in the feet, and it can also happen in the penis. So it destroys those arteries and capillaries, taking blood to the penis, and those vessels are not able to respond to the stimulation of the hormone we talked about earlier. Also, use of certain drugs like antacids that they use to treat ulcers, ulcer medications, sedatives, diuretics. Diuretics are used to treat either hypertension, or also used in heart failure, or used in a kidney that is compromised. use of nicotine also, which is smoking. In chronic smokers, smoking chronically increases the one's predisposition to erectile dysfunction by 15%. Okay, so smokers are liable to suffer erectile dysfunction at one point or the other in their life by 15% more than normal people who are not smokers. Okay, so steroids also, antihypertensives, use of some antihypertensives, and so if that is the case, you need to talk to your doctor, because there are some antihypertensives that do not cause, whose side effect is not erectile dysfunction, and they need to correct that for you. Or also use of chemotherapies, and then so history of also sexually transmitted diseases and chronic illnesses like cancers, like diabetes, like hypertension. They destroy the blood vessels and they lead to ED. All right, in diabetes have 2 to 3 times more chances of developing impotence, erectile dysfunction, than normal people. Hormonal imbalances, low thyroid hormones, low testosterone, high prolactin, high estrogen also can lead to erectile dysfunction. Lack of desire due to depression, illnesses, or use of medications, and then also waning attraction to your spouse because there's some conflict or some anger or whatever, animosity in between the two can cause it. Hardening of the arteries and the capillaries, what we call atherosclerosis and arteriosclerosis, arteries and capillaries in the penis can lead to it. Aging also, from age 40, men begin to have issues with erectile dysfunction because by now testosterone levels are going down. Some people are beginning to form plaques already. By the time they are 60, 1 in 3 men are battling with erectile dysfunction. All right, so high cholesterol in blood can also lead to it, and heavy metal poisoning, poisoning with lead, with mercury, with arsenic, with cadmium can lead to erectile dysfunction. How do you manage? Number 1, start with lifestyle. Exercising helps a whole lot. Reducing your stress helps a whole lot. And then taking care of any psychological things. If you need to talk to a counselor, if you need to see a therapist, a sex therapist, psychological, or if there's animosity and conflict in your marriage, you need to you need to correct that. Okay, some men develop erectile dysfunction because they are no longer attracted to the body of their spouses. Maybe the woman has lost shape and she's not well kept and all that. If you tell her, you people can work together on that, and then she will become attractive to you again, because it's not every kind of woman that men are attracted to. Very, very important. Okay, so all that. Limit stress, very important. We've said that. And then as you age, you just know, we said aging causes. So as you age, know that you may require more stimulation and longer periods to achieve erection. So you need to be more patient with yourself. Your spouse needs to be more patient with yourself, with you and with herself also. Food helps. So you need to change your diet. Stop taking animal proteins except fish. Do away with eggs, milk, beef, chicken, turkey. Do away with them or limit them drastically. Do fish, scaly fish, especially the dried one. Okay, anything sweet contains either glucose or fructose. And when you take too much of it, if it gets into your body and your body uses the ones it will use, the other ones are converted back to fatty acids and they are stored up as cholesterol plaques in your blood vessels. All right, so eating of fried things, you need to stay away from eating and abusing of fried things and using of bad oils. Okay, any oil that on standing cakes is bad oil. Oil should not cake. Oil. So what are the good oils? Use canola oil, or best of all, cold compressed olive oil. All right. Also eliminate wheat and flour from your food. Anything made from wheat and flour, eliminate them from your food. Eliminate MSGs and flavorings and colorings and all these funny chemical things that they put inside food. Those things are outright poisons and sweeteners. Just eliminate all of them. All right. So we have said eliminate stimulants like alcohol, like narcotics, marijuana, cocaine. Remove them from your food. So what food should you eat? Vegetables, nuts, seeds, olive oil, whole grains, okay? Very, very good whole grains, millet, guinea corn, oats, maize, and all that. Whole grains generally. Eat beans, eat rice, especially basmati rice or brown rice, and increase your fiber intake in your food. And then the good oils you can use are oils like canola oil and olive oil. We've talked about it. Pumpkin seeds, bee pollen, royal jelly help you, okay? And also pomegranate juice also help to correct erectile dysfunction. All right. So there are some other devices. We've talked about exercises. Exercises are very important. If ED is linked to high prolactin levels, it can be corrected. If you contact us, we'll tell you, we can help you to correct that. And then there are vacuum constriction devices, VCDs, special devices that if we have tried other things, it's not working, and you can't go and buy this thing just like that. A specialist need to help with it, both with the choice of the one you pick and with training you. You wear it on your penis and then you pump it. So the penis becomes turgid and erect, and then there's a band on it that you just slip into your penis and use it to hold it there for like 30 minutes, and then the person can have an adequate intercourse. If you are dealing with premature ejaculation, it's very simple to deal with. Okay, use condoms. Buy 2 sets of condoms, ribbed condoms and spiked condoms, and wear one ribbed, wear the other spiked on it, or you wear the spike and wear the ribbed on it. And then if you like, you can wear three or even 4. Why I'm insisting spiked and ribbed is your wife will feel you, because why some women refuse condom is they say they can't feel their husband. Your wife will feel you, and then when you have done and you are tired, maybe 10 minutes, 20 minutes, you can remove it and just drive everything home. I mean, it will help you almost miraculously, I'm telling you, if you are dealing with premature ejaculation. Some herbs to use are membrane oil. Some herbs and supplement. Membrane oil, iodine supplements if there's a low thyroid hormone, selenium, zinc, L-thyroxine, vitamin E, vitamin A, high doses of vitamin A, 15,000 IU. Herbs like ashwagandha, sarsaparilla, Jamaica sarsaparilla, schizandra, damiana, wild yam root, gotu kola, yoimbe bark, donkwai, hydrangea, saw palmetto, Siberian ginseng, and then goatweed, honey goatweed. All these things, we have them as products and they can be sent to you. All right, so that's how to deal with erectile dysfunction naturally. Do not keep quiet. You can find help. You can find help. But before I go, I would like for you, as we're talking now, to subscribe. Very important. Press on the subscription button and also the notification bell. Press it so that when we upload new videos, you will at once know that we have uploaded videos. Also, send this link to somebody that you know needs them. Okay, and then also like us, like this particular thing. When you like it, it draws more traffic. All right, that's there. So you can reach us on WhatsApp mostly. Send us your requests or your complaints on WhatsApp, and then if we need to call you, we'll tell you specifically to call us, and we'll give you a time. All right, we're becoming more busy. That's that. Follow also on other social media handles, on other social media by following the handles. All right, we train corporate executives in corporate trainings and retreats. We have done trainings for MTN, for First Bank, for several organizations. Okay, we have also done trainings for state governments. Okay, so we can come and train your corporate organization. Also, we speak in conferences and seminars and retreats and all that. Just gather the people of God or your people, and then we'll come and train them. People need to be healthy. If your people are healthy, they'll be more productive. All right, so, and then also we have a monthly training, second Wednesday, Thursday, and Friday of every month. We do trainings, and if you live outside Lagos, you no longer need to come to Lagos. You can join the training by Zoom. It's a paid training, and if you call in, we'll explain to you how you can get involved. All the things we talked about here can be sent to you. They can be shipped to you wherever you are. Do not forget, subscribe, turn on notification, like us, and then send this link to somebody who you think needs it. We have some books here. Our books are still here. Sickness-free, fail-proof protocol for regaining and retaining health. It's there. Reversing diabetes naturally, Dr. Chris Williams. And then Dr. Chris Williams and Daniel Ekele, reversing depression naturally. There are some other books also. Make Your Food Your Medicine by one of my associates, and Living a Disease-Free Life also by one of my associates. Do not forget, all these things can be sent to you. Our books can be sent to you. The vacuum constriction device can be sent to you, and then we can monitor you. Don't keep quiet. ED is very correctable. ED is very correctable, very correctable. All right, thank you so very much. Till I come your way again. Bye-bye.